language do you prefer po?
English.
How are you feeling today?
I'm a bit tired, but otherwise I'm fine.
I am here to perform respiratory assessment on you. This will help me evaluate your breathing and lung function. Is that alright with you?
Yes.
Great. Let's start with some general questions. Have you noticed any shortness of breathing, wheezing, coughing, or sputum production?
No, I haven't noticed any major changes.
Alright, let's proceed. As per inspection, your face, lips, chest, and nails are seems normal. I will observe your breathing. I will inspect for nasal clearing and pursed breathing. And please breathe normally. Where I will assess your respiratory rate, and I will take note for rate breathing and using your accessory muscle. Your posture looks normal too. It looks like you can breathe normally now. Upon inspection, there is no presence of nasal clearing, pursed breathing, and using of your accessory muscle. Your respiratory rate and rhythm are normal. For the last phase of inspection, I will inspect for your configuration of chest. I will also inspect for the shape and your scapulae is in the midline. And I will inspect your chest wall if it is symmetric. Now I'll proceed to the next set of assessment. I will start by palpating for tenderness and sensation. I will gently press on different areas of your chest and ask if you feel any tenderness or discomfort. Please let me know if you feel anything unusual. Did you feel any tenderness and sensation while I'm doing the assessment?
No, not at all.
Okay, that's good to hear.
Checking for tenderness helps identify inflammation, injury, or infection in the chest area. This guides further investigation.
Next, I will palpate for crepitus. This involves feeling for a crackling or grating sensation under the skin, which can indicate air or gas trapped in the tissues. I will be pressing lightly on the different areas of your chest. Let me know if you feel any unusual sensation.
Detecting crepitus or crackling or grating sensation helps recognize air or gas trapped in the tissues, indicating pneumothorax or lung damage.
Moving on, I will now palpate for firmitus. This involves feeling for vibrations while you speak. I'll ask you to say 99 as I place my hands on different areas of your chest. This will help me assess the transmission of sounds through your lungs.
Assessing fremitus or vibrations during speech helps in diagnosing lung consolidation, for example, pneumonia, or conditions like pleural effusion or COPD.
Now I will assess for your chest expansion. Please inhale it safely. Okay, your chest expansion looks normal naman po.
Observing chest movement reveals restricted or asymmetrical expansion, suggesting pneumothorax, pleural effusion, or lung fibrosis.
Lastly, I will percuss for tone. This involves tapping on different areas of your chest to assess the underlying structures. It may feel like gentle drumming. To do this, start the apices of the scapulae and percuss across the tops of both shoulders. Then percuss the intercostal spaces across and down, comparing sides. Percuss to the lateral aspects at the bases of the lungs, comparing sides.
Tapping the chest helps determine tissue density, with dullness indicating consolidation and hyperresonance suggesting conditions like pneumothorax.
Next, I will inspect your lung sounds using a stethoscope. May I place it on your back and front?
Yes, go ahead.
Before wandering off, I listen for any presence of DVD sounds, pieces, and bronchi. Ma'am, can I check your back for any lung sounds? Okay, so everything seems normal naman po.
Now, let's focus on the abnormal sounds that can be heard during auscultation. This can provide valuable information about the condition of the lungs and the airways. The first abnormal sound is crackles. It is the discontinuous popping sounds heard during inspiration or expiration. They can indicate fluid accumulation or the opening and closing of collapsed airways, often associated with pneumonia, heart failure, or pulmonary fibrosis. Let's listen to an example of crackles during auscultation. Another abnormal sound is wheezing, high-pitched musical sound heard during expiration. They are caused by narrowed airways, often associated with asthma, COPD, or bronchitis. Let's listen to an example of wheezes during auscultation. The final abnormal sound is rhonchi. It is a low-pitched snoring or gurgling sounds heard during inspiration or expiration. They are caused by the obstruction of larger airways by mucus or secretions, often associated with bronchitis or chronic bronchial obstruction. Let's listen to an example of rhonchi during auscultation.
That completes the respiratory assessment. Based on my observation, everything is within the normal range. I will not document the findings for the medical record. So, based on my observation, everything appears to be normal. Is there anything else, or you have questions?
No, I think everything is fine. Thank you for your thorough assessment.
You're welcome. If you have any concerns or experience any changes, please let me know. Don't hesitate. That's all. Take care and good day.
In summary, the respiratory health assessment conducted by the nurse plays a crucial role in evaluating the patient's respiratory health. It provides valuable information of the patient breathing patterns, lungs function, and potential abnormalities. Through careful observation, auscultation, palpation, and precaution, the nurse can identify any changes of abnormalities in respiratory system. This assessment helps in early detection of respiratory conditions, guiding appropriate treatment and intervention. Regular respiratory assessments are essential for monitoring the lungs function, identifying the respiratory issue, and ensuring the optimal respiratory health. By conducting true respiratory assessment, healthcare professionals can provide personalized care and support the patients, leading to improved overall respiratory well-being.